So hello everyone, our today's topic is the periodontal instrumentation. So how do we classify the periodontal instrument? They can be classified according to the assessment instruments or therapeutic instruments. For assessments include the mouth mirrors, probes, explorer. Therapeutic instruments are the scalers, curette and the files. Now what are the diagnostic instruments? The diagnostic instruments includes the periodontal probe. The periodontal probe, it is used to locate and measure and mark the pockets. So the periodontal probe, it is used to locate, measure and mark the pockets. Second is explorer. They are used to locate the calculus deposits and the caries. The scaling and root planning instruments, they are used to remove plaque, calculus deposit from the crowns and the roots of the tooth. What are the classification of the for supragingival scaling? We use sickle scalers, universal scalers, for supragingival scaling we use sickle scalers. They are heavy instrument used to remove the supragingival calculus. Posterior jacket scalers. These are the sickle scalers, posterior jacket scalers, more scalers. The sickle scalers, they have a pointed tip with a curved cutting edge. So they are designed to remove the large deposit of calculus. The posterior jacket scalers, they are designed for use on the posterior teeth as they have a curved blade with a pointed tip. The Morse scalers, they have a blade that is parallel to the handle. They are used for the supragingival scaling. We can use the surface scalers. They have a straight blade with a curved cutting edge. For the subgingival scaling, we use hoe scaler, chisel and file. So they are used to remove the subgingival deposit. The curettes, they are the fine instrument. They are used for subgingival scaling, root planning and removal of the soft tissue lining the pocket. So curette, they are used to plane the root surfaces by removing the altered cementum and scraping the soft tissue of the pocket. The hoe scaler. The hoe scaler has a flat blade with a pointed tip. So it is used to remove the subgingival deposit. The third are the sonic and the ultrasonic instruments. The next is the periodontal endoscope. The periodontal endoscope, it consists of a thin flexible fiber optic camera that is inserted into the pocket. So the camera will provide a magnificent and illuminated view of the root surfaces, any deposit or the inflammation. So the instruments that are used for cleaning and polishing instruments like rubber cups, brushes, dental tapes, they are used to clean and polish the tooth surfaces. Now what are the parts of instrument? It has a handle, shank and a bucking end. Now let us discuss about the periodontal probes. They are the tapered rod-like instruments. They have a rounded tip and used to assess the health of gums and tooth supporting structures. So used to locate, measure and mark the pockets. So while measuring the pocket depth, the probe it is inserted into the gum pocket, and the rounded tip is navigated along the surface of the tooth root. So the scale on the probe helps the dentist to measure the depth of the pocket. So remember, as you insert the periodontal probe, a firm yet gentle pressure it is applied when inserting the probe. So this pressure will ensure accurate measure without causing any damage to the delicate tissues. So the shank of the probe it should be parallel to the long axis of the tooth surface being probed. So the probe it is used to assess the periodontal status for preparation of the treatment plan. Now periodontal probes, we classify them into first generation probe, second generation probe, third generation, fourth generation or the fifth generation probe. The first generation probes include the William Periodontal Probe, UNC 15 probe, University of Michigan O probe, Marquis color coded probe, WHO probe or the neighbors probe. That we will discuss one by one. So first is the William probe. William probe, it is a common used periodontal probe. It is used to measure the pocket depth and assess the health of the gum tissue. So the marking, remember the marking on the probe, they are on specific markings, that is 1, 2, 3, 5, 7, 8 and 9 and 10. So you can see the marking here, 1, 2, 3, so 4 is missing, 5, again 6 is missing, 7, 8, 9 and 10. So these are the markings shown. The marking at 1 millimeter, 2 millimeter, 3 millimeter, 5 millimeter, 7 millimeter, 8, 9 and 10. So how to use the William probe? The patient is comfortably seated, explain the procedure to them, hold the William probe with the proper grip, insert the round tip of the probe into the gum tissue, maintaining the probe that is parallel to the root surface, parallel to the tooth long axis. So as the probe it is inserted into the pocket, you have to just read the measurement from the probe marking. So this measurement will represent the depth of the pocket. Other is the Michigan O probe. It has a marking at 3 mm, 6 mm and 8 mm. So it is similarly used in periodontal for the periodontal assessment and measuring the pocket depth and assessing the health of the gum tissue. Other is the University of North Carolina 15 probe. So UNC 15, it is, remember, a 15 mm long probe with millimeter marking at each millimeter and color coding, the color coding at 5, 10 and 15 mm. So the UNC 15 probe, it is unique due to its length of, it has a length of 15 mm. So that will allow for the deeper measurement in case where a longer probe is needed. So also pay attention at the 5th, 10th and 15th color coding marking. So these color codes points can provide the visual clues to quickly identify the specific depth as you are measuring. The other is the Marquis color coding probe. The markings are in 3 mm section and it has marking at 3, 6, 9 and 12 mm. It is again used for measuring the pocket depth. Other is the next is the Goldman Fox probe. Same as William probes, but it is flattened, not rounded. So it is named after the dentist who discovered it, Dr. Israel Goldman and Charles C. Fox. Next is the WHO probe. So the WHO probe has a distinct feature that it has a 0.5 mm diameter ball at the tip of the probe. So the probe, it is inserted into the gum pocket with 0.5 mm ball at the tip, gently penetrating the pocket. So it has marking at 3.5, 5.5, 8.5 and 11.5 mm. So this millimeter marking indicates the depth of the gum pocket. Along with that, there is color coding from 3.5 to 5.5 mm. So the color coding extends from 3.5 to 5.5 mm. So this color coding will serve as a visual indicator, making it easier to quickly identify the depth within the range. Other are the CPITN E probe and CPITN C probes for measuring, used for measuring the pocket depth, subgingival calculus and in assessment of the treatment needs. Other is the Neighbors probe. Neighbors probe, it is used to assess the furcation involvement. So that refers to extent to which roots of multi-rooted teeth they are affected by the periodontal disease. Other are the plastic probes. The plastic probes, they are used for the dental implants. So they are used to assess the pocket depth around the dental implants. Unlike the traditional metal probes, plastic probes, they are made from non-metallic material. So that would minimize the risk of scratching or damaging the implant surfaces. So the plastic probes, they are made from medical grade polymers or plastics. So these materials are gentle on the implant surface and reduces the damage of scratching or causing any damage to the implant surfaces. So one of the key advantages of plastic probe is that they are non-metallic. So this makes them suitable for use with the various type of dental implants made of material like titanium, zirconium, ceramic that can be that can cause sensitive to metal instruments. So these plastic probes, they are used to measure the pocket depth around the dental implants. The other is the Florida probe. So it is an advanced dental tool used for periodontal charting and assessment. So it is a computer assessment system that enhances the accuracy and efficiency of measuring the pocket depth. So it combines a hand-held probe with software to create a digital periodontal charts. So what are the advantages? It gives a precise electronic measurement, computer storage data is stored with constant probing force. So it is basically used for measuring the pocket depth. So it has ability to create digital periodontal charts. It is accurate, and also it maintains a constant probing force. So that will give a uniform and accurate results. So the constant force will improve the reliability and reproducibility of the measurement. Disadvantages: lack tactile sensitivity. So these are the disadvantages. Next are the second generation probes. These are the pressure sensitive probe. The force is up to 30 grams. The probe tips remains within the junctional epithelium, and force up to 50 grams are necessary to diagnose the osseous defects. Example: Villacare TPS probe. These are the example of the second generation probe. The third generation probes example is Florida, Foster Miller probe, Toronto automated probes that can detect the cemento enamel junction. Other are the fourth generation and the fifth generation. The fifth generation are ultrasonographic probes that provides the painless probing to the patient. Now next instrument is the Explorer. Explorer, they are the dental instrument used to locate the subgingival deposit, assess the smoothness of the root surface after the root planing, and it also identify the irregularities on the tooth surface. So they have a fine taper tip. The Explorer, they have a fine taper tip that allows the dentist to explore the tooth surface. So by carefully running the Explorer tip along the tooth surface, one can detect the hidden calculus deposit that can be missed during the visual inspection. Along with that, it helps to identify any irregularities, area of tooth decay, roughness, cracks. So these instruments allow for the tactile examination, as the dentist will feel the abnormality that might occur and need further attention. So they are used to detect surfaces for calculus, decalcified, carious lesions, anatomical features like grooves, curvatures, or root furcations. So what are the variations? Other is the chamfered hook Explorer. It has a curved hook at the tip of the working end, so used for supragingival examination for dental caries and irregular margins of the restoration. So the hook shape of the chamfered hook make it particularly used for detecting the subgingival calculus. Other are the cow horn Explorer, also known as cow horn shaped probe, featuring a tip that is curved with shape resembling a horn of the cow, and the pigtail, a tip that is curved in spiral or looped manner resembling the tail of a pig. So they are used in calculus detection in pocket extending no deeper than the cervical third of the teeth. Others are the Orban type, used for assessment of anterior root surface and facial and lingual surface of the posterior teeth. It is difficult to adapt to the line angles and proximal surfaces of the posterior teeth. 1112 Explorer, used for assessment of root surfaces on posterior anterior teeth. The sickle scaler, they have a flat surface and two cutting edge. The shape of instrument makes the tip strong that it will not break off during the use. It is used to remove the supragingival calculus. So the function of sickle scalers involves their unique shape. So first of all, they have a triangular cross section that allows to effectively assess and remove the calculus. So they are specially used for heavy deposit of the removal of heavy deposit of calculus that are close to or near the supragingival area. The sickle scalers, they are used with a pull stroke, mean they are gently pulled along the tooth surface while keeping the tip in contact with the deposit. So it has a arch shaped design that contributes to strength of the tip, preventing it from breakage while exerting force against the tough calculus deposit. Other is the Morse scaler. It is characterized by small miniature blade, useful in the mandibular lower jaw anterior region where the interproximal space it is narrow. So these are the various type of the sickle cells scalers available according to the blade design. Other is the curette. Curette, they are the dental instrument used to remove various tasks like removing deep subgingival calculus, performing root planning and removing the soft tissue lining of the pocket. Curette, it is finer than sickle scalers and does not have any sharp points or corners other than the cutting edge of the blade. So they have cutting edge on the both side of blade. That design allows for the efficient removal of the calculus and the debris from the tooth surface. Other are the universal curette. Universal curette, they are designed with the cutting edge that can be inserted into most of the dentition. So this adaptability it is achieved by altering and adjusting the operator finger rest, fulcrum and hand position of the adapter. So the face of blade, the universal curette, it is at 90-degree angle to the lower shank. So the example of universal curette, it includes the Barnhart curette, Columbia curette, etc. So example are the universal curette or the Columbia curette, 13, 14, 2R, 2L, 4R, 4L. So these all are the example of the curette. Columbia 2R, 2L, 4R, 4L curette. So the adaptability of these curettes allows for efficient cleaning and tooth surface smoothing. So the proper finger rest, fulcrum and hand positioning along with the accurate adaptation, they are essential for use of these instruments. The next is the Gracie curette. Gracie is the area specific curette, which means they are designed and angled to adapt to the specific anatomical areas of the dentition. So they are considered for the subgingival scaling and root planning due to their ability to adapt well to the complex root anatomy. So very important for your exam point of view, the Gracie point, they have a unique angulation with the blade offset at 60 to 70 degree from the lower shank. So that design allows for the precise insertion essential for the subgingival scaling and root planning, so as the lower shank will remain parallel to the long axis of the tooth. So remember, the offset blade is at 60 to 70 degree from the lower shank. Now, what is the difference between the Gracie curette and the universal curette? The Gracie curette, number one, they are the area specific. They adapt to the specific anatomical area of the dentition. They have an offset blade with 60 to 70 degree angulation from the lower shank. Whereas the universal curette, they are more versatile and can be used in various areas of dentition by altering the operator finger rest, fulcrum and hand position. The Gracie curette, they are area specific. They provide adaptation to complex root anatomy, especially in the subgingival area. Whereas the universal area, they are adaptable. They may provide the same level of precision, but they are adaptable to all surfaces and areas and surface. The blade angle, it is at the offset blade is at 70 degree, whereas in universal it doesn't have offset and it is at 90 degree. The cutting edge curvature for the Gracie, it is curved in the two planes, whereas the universal, it is curved in a one plane. The Gracie curette has a one cutting edge. So it has a one cutting edge. This one is non-working side, whereas the universal has two cutting edge on this side as well as on this side. So it has a two cutting edge, whereas Gracie has single cutting edge. The other side is non-working side. So remember this difference. This has been asked multiple times in your entrance point of view. Many a times this question has been asked, very important for your entrance exam point of view. Now the Gracie curette, they are designed for specific areas of mouth. Like for the anterior teeth, number 1, 2, 3, 4 are used for scaling on anterior teeth. For anterior teeth and premolars, 5, 6 number is designed. For 7, 8, 9, 10 they are designed for the posterior teeth, and it can be used on facial and lingual surfaces. Gracie 11, 12 on the posterior teeth, mesial surface, 13, 14 on the posterior teeth, distal surface. New addition has been added like 15, 16, it is a modification of 11, 12, and 17, 18, it is a modification of 13 and 14. So 15, 16, it is a modification of standard 11, 12. It allows for better adaptation to posterior mesial surfaces on the mandibular molars with the intraoral finger rest. Extended shank instrument after 5 curette. These are the modification of standard Gracie curette design. Here the terminal shank, it is longer, is 3 mm longer, allowing extension into the deep periodontal pocket of 5 mm or more. It has a thinner blade for smoother insertion and reduced stretching, and 1 mm shorter blade. Mini bladed curette, Mini 5, they are modification of After 5. Blades are half the length of After 5 or standard Gracie curette with extended shank. Curvette are modification of the Gracie curette. The modification include they have a 50% shorter blade, increased blade curvature, straight terminal shank, and longer terminal shank. So remember all these instruments. Here curette, they are designed to remove the light residual calculus and bacterial contaminants from the entire root surfaces, used with the gentle stroke with either push or the pull stroke. Plastic instrument form for the implants, they have been already discussed. Perio retrievers, very important. The short perio retrievers, they are the double-ended high magnetized instrument used for the retrieval of the broken instrument tip from the periodontal pocket. So they are used for the retrieval of the broken instrument tips from the periodontal pocket. So that's the function of perio retrievers. This image question was asked in your AIMS entrance exam. Identify the instruments. The example is, this one is Schwartz perio retrievers. File instrument that is used to crush calculus deposit. These are the files that are used to crush calculus deposit. Hose scalers, they are used for scaling of ledges or rings of calculus. The blade, it is bent at 99 degrees. The cutting edge, it is formed by a junction of flattened terminal with the inner aspect of blade. The cutting edge, it is beveled at 45 degrees. So the cutting edge, it is beveled at 45 degrees. Chisel scaler, designed for the proximal surfaces of teeth, used in the anterior part of mouth. The mechanical instruments are the ultrasonics and sonic instruments. They are used for removing the plaque, scaling, curetting, and removing the stain. The vibration in the ultrasonic tip, it ranges from 20,000 to 45,000 cycles per minute. And in the sonic tip, it ranges for 2,000 to 6,500 cycles per second. The two types of ultrasonic units, they are magnetostrictive and piezoelectric. So remember, in the magnetostrictive units, the vibration of tip is elliptical. All the sides of tip, they are active when it is adapted to the tooth. But in the piezoelectric, the vibration is in back or forth motion. meaning the two sides of tips, they are the most active. So here the vibration of the tip, it is linear, and in magnetostrictive it is elliptical. Polishing instruments include rubber cup, bristle brush, dental tape, air powder polishing. Rubber cups, these are the rubber cups. A paste that contains fluoride should be used and kept moist to minimize the friction heat. Bristles available in wheel and cup shaped. Dental tape with the polishing paste is used for polishing the proximal surfaces that are inaccessible to polishing instruments. Air powder polishing. The device is known as Profijet that delivers air powder slurry of warm water and sodium bicarbonate. So remember, for your entrance exam, the air powder polishing cup will include which ingredient? It is sodium bicarbonate and warm water, and device is Profijet. So they will remove the extrinsic stains and the soft deposits from the mouth. Endoscope, it has been used subgingivally for the diagnosis and treatment of the periodontal pocket, allows the clear visualization deep into the subgingival pocket and the furcation area. The periodontal surgical instruments, they are classified as incisional instruments, surgical curette, sickles, periosteal elevators, surgical chisels. The incisional and excisional instruments, knives, they are the basic instruments. They can be obtained with the both fixed and replaceable blades. Example are the gingivectomy knife, they are Kirkland knife, interdental knife, Orban knife, Merrifield knife. Surgical blades 12D, 1511, 15C, all are the incisional and the excisional instruments. Periodontal knife, the Kirkland knife is one of the typically used for the gingivectomy. This knife can be obtained as either double-ended or single-ended instruments. Interdental knife, Orban's knife or Merrifield knife, they are used for the interdental areas in the case with the gingivectomy. So these are the gingivectomy knives, Kirkland and the Orban knife. Bard Parker handle used for cutting gingival tissues and making surgical incisions. Surgical blades, most common blades are 12D, 15C. 12D, it is a beak shaped blade with a cutting edge. So 10, 11, 12, 15 number, they are easily available. Surgical curette and sickles, larger, heavier curette and sickles for the removal of the granulation tissue, fibrous interdental tissue and tenacious deposit. Periosteal elevator, they are needed to reflect and move the flap after incision has been made for the flap surgery. Example, Woodson, Glickman, Pickard elevators, they are well designed periosteal elevators. Tissue forceps used to hold the flap during suturing. Chisels hoe used for removing and reshaping the bone. Surgical file, Sugarman periodontal file used interproximally. So this question was asked, identify this instrument. It is Sugarman periodontal file. Schulzer periodontal file used interproximally. File surfaces on the both sides allow push or pull application. Oshman chisel. It is that Oshman chisel, remember, for your entrance exam point of view, it is used in the interdental area. Reverse section chisel or Rhodes chisel, it is used with a pull stroke, removing the bone adjacent to the tooth without causing trauma, used on the distal of the last molar. Eyelet curette. Hemostat, it is a surgical tool that is used to control bleeding. So it has a handle that can be held in place by locking mechanism. So this allows the clamping force of the pliers, and the force, it is between the 40 Newton. Surgical scissors for removal of the tag of tissues during gingivectomy, trimming the margin of flaps, removing muscle attachment in mucogingival surgeries. Various type of scissors. Goldman fork scissors. So they are curved beveled blade with serrations. So remember all these. Surgical nippers, same purpose as scissors, for contouring the architectural form and forming the interdental slices. Needle holder, it is used to suture the flap at desired position after the surgical procedure has been completed. The example is Castroviso needle holder. So this one is the needle holder. The surgical burrs, they are used to remove the bone and section the teeth. EVA system, it is the most efficient and least traumatic instruments for correcting overhanging or over contoured proximal surfaces. So it is used for correcting the overhanging or over contoured proximal surfaces and resin restoration. Again, important for your entrance exam point of view. Many a times asked in entrance exam, the EVA system contains, it is used for correcting overhanging, over contoured proximal surface. The files, they come in the pairs and made up of aluminium. One side